So Millie presented to us because she was very acutely lethargic. She'd been okay the night before, and then her owner found her acting very abnormal. She was actually hypersalivating, or had a lot of extra saliva at her mouth, and didn't really want to move or walk around or get into trouble, which is not normal for a pig. So when we examined Millie, she just lay very quietly and let me do a full exam on her, which is very abnormal for pigs. They tend to yell a lot and don't like to be touched. So that alone told us that she was very sick. So we gave Millie some sedation and performed some blood work and some x-rays and eventually an ultrasound on her. The x-rays and the ultrasound were very suspicious for some sort of process obstructing her small intestine.
So Millie had a condition which we call intestinal torsion. It's basically twisting of the intestines, and that causes the blood supply to be cut off, and that part of the intestines basically dies. Also with the twisting, it kind of causes a blockage where the fluids within the intestines cannot pass because of the twist. And so it does require us to remove that part so that the patient does not become really sick from all that dying tissue. The next step was to do surgery. And with surgery, prior to getting them into the OR room, we do have to get them pretty stabilized and give them medications so that they're relaxed, and so that does involve giving them pain medications and sedatives prior to doing intubation. And intubation in a pig is quite difficult, which I did not do, and I had to rely on Dr. Schachterle to do that part of the procedure. So once we got into the OR room with her assistance, we were able to do an exploratory laparotomy, or basically examine Millie's abdomen, and found that she had an actual twisting of her small intestines, maybe what we call like an intestinal torsion. And so we, in terms of surgery, across all species, whether it's a cat or a dog or pig or even a human, surgical technique, sterile technique is always important. So we were able to go ahead and continue and do a intestinal resection and anastomosis, basically removing part of Millie's intestine and putting it back together, and then basically supporting her the best we can post-operatively with IV fluids and pain management.
So after surgery, as Dr. Kim said, Millie stayed in the hospital for a couple more days. She was maintained on IV fluids and some good pain medications post-operatively, as well as some medications to help support her GI tract and encourage it to start moving and working normally again after surgery. So a couple days after surgery, she started eating on her own again and became much more active, and went home 3 days later. We rechecked Millie 2 weeks after her surgery. She was much more active, was ready to run around and play. Her incision was healing very well, and when we rechecked her blood work at that time, all the abnormalities that we had seen secondary to her intestinal torsion had resolved, so her blood work was back to normal.